Doug, thank you so much for being here today. My goal today is to show people how to use the shoulder reliever, this product that they've bought. They're not sure what's coming. I want you to show them how it's used, and I'll sort of chime in with some thoughts as you go.
Okay.
Okay, so there's our daytime exercise component. This is the modality that we call dynamic stabilization that we're super excited about. And this, over 10 years, has really proven to be, I think, the critical part of sustaining the success that we get with this. And as I grab my shoulder model here, I can tell you that what we're trying to do is we're trying to get these muscles stronger without getting all the other muscles stronger, because the shoulder is kind of a yin-yang. There's muscle balance, and we're trying to get the deepest, most important muscles of the shoulder stronger, and in the process that opens up this space. So with that being said, show us how it's done. Okay, so we tell people 30 revolutions one way, 30 the other. I think we would like your shoulder or your arm a little bit more extended.
Okay.
It's good. You're not moving your wrist. All the power is coming from the shoulder. Can you feel it up there?
Yeah, for sure.
Good. Now I can tell you, when a lot of people are in tough shape when they get this, and they can't even hold their arm out like that. So we tell them, bring it down to waist level and do it.
Yeah, that's easier.
It doesn't. It's not as pinching. And then as they get success over time, they're going to notice that their arm will migrate up to shoulder level.
So do I opposite direction?
Yes, clockwise, counterclockwise, 30 revolutions in each position. And so you are demonstrating position 2, which is straight ahead. We also want straight to the side. And the third position is just in between those two.
Okay, so kind of in a 45.
Yeah, and so we go, yeah, let's have you switch the direction again.
Okay.
Perfect. And then the last one is just you bent over at the waist. And yeah, sort of on that
Get
plane.
it out away from your body a bit.
Yes, we've had some shin bangers, so you got to be careful with that. But that is dynamic stabilization. This is, let's have you go up with one of the heavier balls and tell us how that feels.
I'll jump up to the red here.
Okay, so our third ball, so typically this would be days 20 to 30. You'd be using this, although that's not set in stone. If you want to stay longer on a ball, that's fine.
Significant difference in weight here.
Yeah. We tell people, hey, you're going to have the strongest rotator cuff on the block after you're done with this. And it is and not surprisingly, we are, like with any muscle, we're slowly and steadily able to get it stronger with the appropriate use. We do not want people doing it more than once a day. Some people are, for some reason, the rotator cuff doesn't like that, and so we'll have you just say it at once a day, and slowly and steadily that muscle will respond. And in that process, we believe, and we're doing research on, we're sort of resetting that space and opening this subacromial space, allowing blood supply to get where it needs to go. That being said, that's a pretty good opening to talk about our nighttime component, which is really what we've done the most research on. So we connect from the wrist to below the knee to help the shoulder. So good. And yep, below the knee, and you're gonna attach our quick release strap. And there you go. And people ask me all the time, I think people look at this and they're like, how am I gonna sleep with this? And I can tell you in our research, people wear it for an average of 5 hours at night. And every hour that you wear it, you are helping open this space and get if the space is like this and clamped down and it's made worse at night because you're losing gravity, because you're lying down, you won't get any oxygen or blood supply to this area. It's not going to heal, and you're actually hurting yourself at night.
Sure.
So I think that one of the successes over the last 10 years of this product has been we break that nighttime injury cycle. And that's critical. How does it feel?
It feels good. Does it have to go to the same side?
Most of the time it goes to the same side, but sometimes, particularly I think when people have some problems with this muscle in back called the infraspinatus, it's going to feel better if you go to the opposite leg. And so, and we used to think, when I first put this out, I thought the magic was in the, maximal traction and let's open this space, and that's not it at all. Really, the magic of this, breaking the injury cycle, is about not sleeping on that shoulder and not putting that arm up. So that is so hey, 40 nights with that, 40 days with the exercise, and you should be good to go.
Excellent.
All right, good.
Thank you.
Thanks so much, Doug.
You bet.
Appreciate it.